May I come in, ma'am?
Yes, come in.
Thank you, ma'am.
May I come in, ma'am? Come in. Good afternoon, guys. Good afternoon. Today, guys, we have a new topic. It's about pathological science in ECG. And today, for first, I must say that all diseases, heart diseases, it's the first one of the first diseases in every world. And according to the World Health Organization, here are 4.5% of people in the population can die with this disorder. And every year it's increasing. Yeah, every year 4.5% people die from cardiovascular diseases. And thus we have so many techniques, examinations for these drugs we have, but it's it's increasing. Yeah, and it's can suffer more and more young people, beginning with age 30 to 70, 60 years. It's not depends of age, yes, and so I think it's very actual problem in the world, and one of the main diseases from sudden death of patient. And it means that every professions can face with these cardiovascular disorders. Now, remember ECG program, we need to use today ECG apparatus, and we need remember how it's using, and which elements we can see here, which waves in ECG, and their meanings also, yes. For this, I need one volunteer, because we're using now real ECG. Who wants, guys? Raise your hands. Yes, please. And one patient, that's an adult. One doctor and one adult. Yes. Yes, can you please? For examination, yes, we're using some rules, yes? We're using some rules.
First we remove the clothes of the patient.
Yes, please ask patient. Yeah. Yes,
Yes,
remove this. Yes, we can use remove your clothes. Yeah, upper part clothes.
upper part was removed.
Yes, remove. Yes. Okay.
Supine position. Get on supine position. We make the attachment of the leg.
Okay. Now, Rupesh, you please help also for preparing the patient. Yes. Yeah, for as an assistant, Rupesh help. Line position, yeah. Okay. Yes. Connect apparatus. Yes, good. We must connect apparatus, ECG. Yes. Check ECG functions. Yeah.
If you are wearing any metallic elements like earrings,
No.
any rings, no, and any electronic device with you. Okay.
Then we start up position.
Now, Samir, beginning please your exam, yeah?
Yes,
Now
ma'am.
you have.
Ma'am, firstly we apply the jelly for frictions and for good conductions.
Okay. Yes, good.
Yes, ma'am. We apply gel and the red lead on the right hand.
Okay.
At the arms, it's called AVR leads. Green. Left leg, greens on left leg. And yellow on left hand. AVL lead. Black is a neutral point. For
Okay, good. Very
then
nice.
we adjust chest leads.
C1.
C1 lead on the right hand side or second intercostal space, and V2 on the left hand side.
Okay.
And then we start ECG on the ECG machine.
Okay.
New ID. Then we add the name.
His name is Sharon.
Yes, of course. You must write name. Yes, age.
Yes, ma'am.
Sharon Hamid.
Age. Patient age 22. Then we start.
Okay.
And then we make a print.
Yes, of course. Print. Now it starts, yes?
Yes, ma'am.
Okay. And patient this time not moving, not talking, yes? And we have very quiet remain focus. Yes, guys?
Yes, ma'am.
And after 4 heart cycle, it's stop, yes? Yes. Yes. Okay, take photo.
We'll do.
Yes, cut. Yes.
Cut.
Yes. And check. Yeah.
We found the ECG that normal ECG.
Yes, okay.
No elevation, no any elevation in the ST elevation, no depressions. P wave is normal in scene.
Yes.
Any wave QRS complex is normal, and QRS length or width same, ma'am. That's
Okay.
normal.
So every waves on the place, PE, QRS complex, interval segments, T, yes, everything here. So it's is it normal ECG?
Yes, normal
Yes,
ECG.
it's normal ECG. Yes. Now please finish. Turn off. Yes.
And we stop the ma'am. Generally, ma'am, track. Ma'am, then we turn off the ECG,
Yes.
and then we off the ma'am, and we remove the leads.
Yes, of course.
Firstly, patients.
Yes. This way, okay. Okay, good, very nice. Okay. Now, thank you guys. Yes, take your phones. Yes, take your seats. Yes. Okay, guys. Now, you are really about ECG apparat, normal waves, their meanings. Yes, you know everything. It's very nice. Now, to start about, I will give you some. We have today pathological science in ECG. That's why. You must also remember here, but before beginning, for today's lesson, you will able to know about pathological, what is mean arrhythmia, types of arrhythmia, how you can identify types of arrhythmias on ECG, and you will able to know about symptoms, causes, some methods for this, yeah, and ECG, describing also ECG. You should able to know this. So we should start about arrhythmias. For arrhythmias, you know that it's very gross condition for patient. And it's here we can see different etiology, different risk factors, yes. And who wants to describe about arrhythmias and which causes here? We can see, yes. Raise your hands, guys. Yes, causes. Yes, please.
Ma'am, arrhythmia means irregular rhythm. Here, ma'am, we can see means heart is a bit too fast or too slowly. Ma'am, irregular rhythms are here. This syndrome is associated with a violation of the functions of the excitability, automatism, and regular functioning of the heart. We can see here.
Yes. Are you agree, guys? Yes, of course. It's arrhythmia means we can see here slowly or rapid or fast rate. Yeah, here we can see on ECG. And exactly ECG give us exactly which type of arrhythmia. That's why we used ECG apparat. Yeah. Guys, now we will take some games. It's named Kahoot games. You should here find some questions and immediately answer, find one option. Yes, correct option. Now please, to get join, write this one. 8247492. Guys, did you write?
1 minute.
Okay. Okay. One here game player. Okay, two. Okay, Fatah here. How many students? Three, 4, 5, 6, 7, 8, 9. 9 players must be here. 3, 4 students.
Yes, on spot.
Divide, yes.
Next very slow.
Yes, maybe some techniques here, internets, yeah? Yes, of course. But wait, guys, after sometimes, maybe.
Okay, I'm left. Oh,
You can also
okay, go, we can go. Start. Go, start.
Okay, guys. Okay. You should start, guys, because we have time. Now, those students who are game players, you please take game. Now you can start, guys. Okay. Okay. Okay, begin, guys. The purpose of laboratory testing of blood gas composition is to diagnose. Oh, respiratory failure. Next, okay. Okay, Adarsh, very nice.
No problem.
Now, next question, guys. Okay. What do additional research methods include? Okay. Medical history, auscultation, laboratory methods, or topography? Laboratory methods.
Next one.
Pavita. What does analysis include? Main complaints, physical examination, laboratory test, instrument examination. Okay, nice. Next question. What is the lateral curvature of the spine called? Scoliosis. Scoliosis. Sharon Hunt again, yeah? Okay, good. Okay. The last question. Voice tremors in large focal integration syndrome. Now your results, guys. Look at here. Third one, Varun. Second one, Sakshi. And first one. Okay, congratulations, our winners. Thank you. And at the same time, check already your knowledge. Yeah, guys. Thank you so much. Now, we should know here also about symptoms. Which symptoms can you hear for arrhythmia? Yes, different types of arrhythmias have their specific symptoms, but generally we can see some symptoms. Yes. Yes. Yes, please.
Ma'am, there can be discomfort in the chest. There can be slow or fast breathing.
Yes.
There can be cases of fainting, dizziness, lightheadedness, and fatigue.
Yes, of course.
These are some general.
Yes, of course. Are you ready, guys? Yes. Sit down, please. Now I will give you some tasks. It's about some conditions of patient and in ECG program. And you should identify here which type arrhythmias and also describe them. Now we divide to the small group, and I will divide first group, second group, third and fourth. Okay? Now in first group, coming one student and choose one ECG gram. Okay, coming. Okay. Second group coming, one student. Third group coming, please. And last one. Okay. Now, guys, I will give you time for this. If you please, okay, 5 minutes.
Also known as V-fib.
The leak in myocardial infarction is caused due to the
Okay, guys, now are you ready? Finishing, yes? Okay, guys. Number 1 group, first group, you please start which type ECG and your diagnosis, yeah? Which diagnosis?
Ma'am, this ECG is report of sinus tachycardia. Ma'am, here we can see reduction in RR interval, and ma'am, demands T wave we also see here, and ma'am, ST segment depressions in V2, V3, V4 leads, and ma'am, narrow QRS complex we also see here, and ma'am, heart rate is more than 120. Then ma'am, it says condition of sinus tachycardia.
Okay, are you agree, guys? Yes. So here we can make some conclusions that sinus tachycardia, it means when heartbeat it's more than 100 and then yes, and we can see what very rapidly rhythms in ECG-gram, yes, but all are waves here. P wave, QRS complexes, yes. Also,
And ma'am, regular rhythm is here.
yes, it's a sinus tachycardia. Okay, yes, thank you, good. Now, please, second group.
Ma'am, after seeing this ECG, ma'am, we make conclusion that it is a ECG of myocardial infarction. Ma'am, we can see here, ma'am, the depression of ST segment. Ma'am, so ma'am, here ma'am, we can it is a ST depression of below than 1 mm. So ma'am, generally we can distinguish between ma'am myocardial infarction and between ma'am is earlier factor is that ma'am here ma'am pain is about ma'am more than 30 minutes after giving that nitroglycerin also. So ma'am and after that ma'am here pain is about more than 30 minutes or more than 1 hour. Ma'am generally it's echoing it is a pressing condition of the pain behind the sternum and others. And ma'am after that ma'am we can also see ma'am it is divided like in typical and atypical pain. Ma'am in typical pain ma'am like in its exact location ma'am like in the sternum or behind the sternum, and atypical pain generally dysphagia ma'am other ma'am like arrhythmia and others. Ma'am main cause of myocardial infarction we can see here is ma'am atherosclerosis or ma'am generally or ma'am atherosclerosis and ma'am thromboembolism of the ma'am coronary artery.
Yes, of course. Are you agree, guys? Yes. So maybe here we can see several types of myocardial infarction, and it's suddenly coming. Sometimes symptoms asymptomatic or with symptoms, yeah, can patient coming. But on ECG we can see in exactly specific signs.
The ECG that is given to me is most probably the ventricular fibrillation. As a case study is described in here, a 61-year-old female was admitted, no history was there. and he had a history of coronary artery diseases, and her blood pressure is 220. So while observing the ECG, there is no P complex, there is no P wave, there is no QRS complex, and there is no T wave. So most probably there is an arrhythmia is present. So in this we can see that there is no type of complexes formed. No, there is a pathology in this. So most probably ventricular fibrillation, because ventricular fibrillation is denoted as the coarse ventricular fibrillation. Fine ventricular fibrillation will be a small line, but in this ECG we can see coarse ventricular fibrillation. So ventricular fibrillation is mostly occur when the ventricular part is not acting properly, or it will be tachycardic, because of the shift of the SA node or the pathology in the myocardium. So in this case, the BP is around greater than or equal to 100, following by a cardiac attack. So the past history can be any past medical diseases related to heart,
Some operations,
heart,
some medicine.
and common symptoms are like disease, illness, dizziness, dysphagia, sudden weight in the chest, and sudden breathing, chest pain, etc.
Yes. Guys, are you agree?
Yes.
Is it ventricular fibrillation? Yes, of course. We can see here, here anything here, yeah? No QRS complexes, no waves, P segments, intervals, no here. Just we can see what? Deformations, yeah? Yes, it's also one of the big growth condition, yeah? Now, fourth group please, ECGs.
By the given ECG to us, we can find that this is a Mobitz 2 AV blockage. So in this ECG, we can see some of the changes, like there will be constant PR intervals, and we can see the QRS complex missing and the dropped off QRS complex. So this can be when it can be happened means due to the loss of ventricular contractions occurs without the prior extensions and the pulse delay at the AV node. So due to this QRS complex missing, there will be a ventricular rate slower, and rhythm also will be slower. So symptoms, if we can see in this case, means like this fatigue, dizziness and chest pain, and sometimes a sense of heart failure and cardiac arrest also will be seen in this case.
Okay, so your diagnosis is AV block, yes?
Yes.
But in AV block, we can see here several types, yes? Here, which type you have?
Mobitz 2 AV.
Yes, Mobitz type 2, yes. So here we can see differences, in which place? In P wave, yes? In P wave, yes. Are you agree, guys?
Yes.
Yes. Okay, thank you. Now, good guys, you know pathological ECG, you know normal ECG, you can make a difference, we can make differentiate, yes, arrhythmias, you can checking ECG and make some analysis, yeah, it's easy, and it's very good. Now we have also a method which also help for us, for students, making and remember some signs, symptoms during examination of patient. And one of this method is interactive method we using here now. It's now Leonardo. It's men we using this for method for identifying which symptoms, which signs. Yes. Now for today we have it's which type, guys? Abnormalities in ECG. Ventricle fibrillation. Yes. Now for this we have specific symptoms. Yes. So how we can identify? We will checking now. Now, guys, I will ask you which symptoms now you can see here. Cyanosis. Yes. In which place you can see cyanosis, guys? Yes. One student, please come and show, please. Because very far students not see this. Okay, come here and show. Where is cyanosis?
Ma'am, in the hands. We can see blue color cyanosis. And also in the cheeks, ma'am.
Yes, of course. Are you okay, guys?
Yes,
Yes. It's cyanosis. Usually it's come from heart.
Yes, ma'am.
Disease. Yeah. Okay, sit down, please. We should use a new technique. It's Leonardo. It's an example for symptom signs provides. Now I need one student, and this student please demonstrate signs of heart diseases. Guys, raise your hands. Who wants? Yes, come please. For heart disorder, we must know specific symptoms. Yes, that's why please demonstrate which signs we should see during examination.
Firstly, we should look the hands of palm area present if there is any cyanosis. Like there is a normal, if there is a pathology, we can present the cyanosis like this. There is in the palmar region and these cells also we can see the cyanosis.
Okay.
So present is here, you can see the cyanosis. Next, look at the radial and brachial pulse. So while examining, put the fingers like this and check the pulse. Firstly, fully press and then normally localize the pulse.
And how much it will be? Pulse?
In the cardiac diseases, it will differentiate according to that. In ventricular fibrillation, it will be tachycardia, it will be more than 100. In bradycardia, it will be less than 60.
Yes. Okay.
And while checking the the radial brachial, then we will go to the carotid pulse. While checking the carotid pulse, firstly we should check the one side. We can't according to the protocol, we can't check both sides of the carotid. So firstly we should check the carotid pulse with one hand.
Okay.
And then another. So if we are feeling more carotid pulse, there is a pathology in there. And then look at the periphery visualization. Look at the chest expanding, like it's expanding symmetrically or asymmetrically, like applying pressure on the chest wall.
Okay.
So if there is any pathology, we can easily differentiate. If we can differentiate the asymmetrical movement of the chest, and if there is any mainly coronary artery disease, we can come to the lower part and check for there is an edema.
Yes, of course.
Like bulging.
Yes, both sides.
Yeah,
Yes.
both sides we should check. Like
Okay.
you should differential check. If there is any edema present, any bulging, any redness, any swallowing.
Okay. After which times we can identify is it here edema or not?
So we should firstly we should visualize. Firstly we should place our press here. If and press for 2 seconds and take our hands. If the swelling is persisting, if the tip is there, there is an edema, and compare with both legs if there is edema or not.
Okay. Yes. Are you agree, guys? Yes. Listen, guys. Look at this man. Look at this man. And I will give you some symptoms, signs for heart. Yeah? You please identify and make some diagnosis, okay? Now, this man, very heart condition, 36 years old, and he has pain in the chest, problem, shortness of breath, pain, chest pain, which is radiated to the left hand, left shoulder, left neck, jump, yes, and a problem of shortness of breath. Now please identify. Who can identify which hair diagnosis? Yes, come here.
As the symptom said, the pain is radiating towards the arm. It could be a reversion pain that it might be a coronary artery disease. So for treating coronary artery disease, we are giving nitroglycerin orally as well as through injections. If it is given orally, we would be giving it sublingually, but now we are going to give it as injection.
Okay, why we should give nitroglycerin?
To relieve the pain.
Yes, of course. Now please.
So it's nitroglycerin. So now we are going to give nitroglycerin.
Okay. Okay, very nice.
It helps to relieve the pain.
Yes. So we can see, guys, exactly. Are you agree, guys? That it's a coronary disease, yeah, and we can checking by symptoms and first hoping for by nitroglycerin. Yes. Okay, guys. You also need to know about auscultations method. It's one of the best examination for heart, and you need to know about points of auscultation, their meanings and their names. Okay, who wants, guys, demonstrate? I need two volunteers here. Come here, raise your hands, guys. Okay, Rupesh, and one more. Yes, come here. Now, take about instrument also you must say which, okay.
So there are 5 points of auscultation.
Okay.
First is
In secondary coronary space, there are 2 points.
yes in right side of sternum. In second is second intercostal space. Here is aortic point. Here we can see. Here we can hear a pathological sound in pathological conditions. In left side of sternum, in second intercostal space, here is pulmonic point, and in third intercostal space, Erb's point, and in fourth intercostal space, tricuspid point, and in fifth intercostal space, mitral point.
Okay.
We can.
Yes. Are you agree, guys? Yes. Every 5 points we must check. Every points. Why? Because we should know after this which sound here present. Usually when we begin, we checking this by rule. We must checking by fifth intercostal space. Fifth intercostal space, middle clavicular line, and then we should go into the second right side, then second point left side, and then fourth intercostal space and fifth intercostal space. Okay, with these rules give us more information because disorders come to the patient. Our sounds here appearance. Our appearance begin with fifth intercostal space. Yeah, left side. Okay. Yes, good, very nice. Guys, and one more question, last question. Guys, did you take some information, some after studying, after teaching, after practices? Did you take some knowledges, guys?
Yes.
Yes. Did you know how we can identify normal ECG?
Yes.
Did you know how we can identify pathological signs in ECG?
Yes.
And did you know the specific symptoms for coronary heart diseases? Yes. Thank you, guys. And I have a home task, guys. It's not enough. In your home task will be thus we have so many different types of ECGs, arrhythmias, yeah. You should take at home several types, for example, extrasystoles, yeah. You should take arterial flutters, yes, types of fibrillation, some atrial, ventricle. It will be your task. And the next lesson we will beginning with your task.
Okay.
And preparing next topic.
Okay, ma'am.
Yes, thank you guys so much.
Thank you, ma'am.
I will put your marks for today. Okay, thank you so much, guys. You are free, guys. You can
Thank you, ma'am.